Collagen is the most abundant protein in your body, making up about 30% of your total protein. It's the primary building block for connective tissues. Think things like skin, muscles, bones, tendons, ligaments, blood vessels, and even your gut lining. Collagen gives your tissues strength, structure, and elasticity, and it's essential for wound healing, new cell growth, and even blood clotting. But do you need it? Can collagen supplements help with your endometriosis symptoms, recovery from excision surgery, or just support your overall health? In today's video, we're breaking down the different types of collagen supplements, the science behind collagen for endometriosis, and how to choose the best, cleanest brand for your needs. If you're ready to get the facts and not just the hype, hit that like button, subscribe, and let's dive in. All right, so let's start with the basics. What is collagen? Like I mentioned in our intro, collagen is the most abundant protein in your body, making up about 30% of your total protein. As we age, and especially in chronic inflammatory conditions like endometriosis, our natural collagen production drops, and this can lead to weaker connective tissue, slower healing, and more inflammation. All right, so let's talk about where do we get it? Where do we get collagen? You can get collagen from two main sources. Natural food-based sources like bone broth, and homemade is always best. Animal skins, especially from chicken, pork, or fish. Gelatin, so think slow-cooked stews or jellied meats. Wild-caught salmon and sardines with skin and bones. And egg whites. And the second main source is through collagen supplementation. Collagen peptides, or hydrolyzed collagen, are the most common and best absorbed forms. These are broken down into small peptides for easy digestion and absorption. Gelatin is another source. It's less processed, but not as easily absorbed as peptides. And undenatured native collagen is used most often for joint health, but less common for general supplementation. So now let's break down the main types you'll see on the shelf at your local store. The first type is bovine collagen sourced from cows, which is rich in type 1 and type 3 collagen. Type 3 collagen especially is great for skin, bones, and muscle. The second type is marine collagen, which is sourced from fish skin and scales, and it's high in type 1 collagen, which is best for your skin and your gut. Porcine collagen is sourced from pigs, and it has similar benefits to bovine collagen. Chicken collagen is high in type 2 collagen, best for joints and cartilage. And a pro tip here, collagen peptides are the most bioavailable and versatile for mixing into drinks, smoothies, or even soups. So what are some science-backed benefits of collagen? So the first is skin health. Collagen peptides can improve skin elasticity, hydration, and reduce wrinkles. Joint and bone health is the second. So collagen supports joint function, reduces pain, and may help with bone density, which is important for anyone with chronic inflammation or post-operatively. Gut health is another benefit. So collagen peptides help maintain the gut lining, which is crucial for people with endometriosis who often struggle with gut symptoms. And the last benefit, backed by science, is muscle mass and recovery. Collagen can support muscle repair, especially when paired with resistance training or after excision surgery. So what about collagen and endo? What's the connection? Here's where it gets interesting for endometriosis warriors. Fibrosis and healing is one of the benefits and one of the potential considerations for supplementing with collagen. Endometriosis lesions are associated with increased fibrosis or scar tissue formation, and research shows that endometriotic stromal cells have enhanced collagen contractibility, which is a fancy way of saying they are prone to forming scar tissue. After excision surgery, your body needs extra amino acids, especially glycine, cysteine, and glutamine for tissue repair and healing. Collagen is rich in glycine and proline, but not cysteine or glutamine. So a balanced diet or additional supplementation may be needed for optimal recovery. Another important consideration for whether or not to supplement with collagens when you're living with endometriosis is the chronic inflammation benefit. So what I mean is that chronic inflammatory conditions like endometriosis can deplete glycine, cysteine, and glutamine, making it harder for your body to repair tissue and fight inflammation. Another important consideration for if and when to supplement collagen is post-surgery recovery. Collagen supplementation may support wound healing, reduce inflammation, and help rebuild healthy tissue after excision surgery. Pairing collagen with vitamin C, which is needed for collagen synthesis, can further boost healing. Some great additions alongside collagen include citrus fruits, freshly squeezed OJ, guava, peppers, or broccoli. All right, next let's talk about how much collagen should you take if you're going to consider supplementation. So a typical dose, and most studies suggest using 2.5 to 15 grams of collagen peptides per day for skin, joint, and gut benefits. For post-surgical healing or chronic inflammation, aim for the higher end of that range, but always check with your healthcare provider for exact recommendations. All right, now let's talk about the best, cleanest collagen brands. When choosing a collagen supplement, look for third-party testing. So you're looking for NSF, informed choice, or some kind of similar terminology on the label. You're looking for brands that have no added sugars, artificial sweeteners, or fillers, and that are sourced from grass-fed, pasture-raised, or wild-caught animals. Hydrolyzed collagen peptides are best for absorption. My top clean brand recommendations include Vital Proteins, bovine or marine, Great Lakes Gelatin, Further Food, Ancient Nutrition, Primal Kitchen, Paleo Valley, and I would highly recommend pairing with their whole food vitamin C supplement or Bulletproof. I put some special links and codes in the caption if you're interested in investing in one of these great brands. All right, now let's move on to collagen supplementation tips for endometriosis. If you're going to supplement with collagen, here are a few tips to get the most out of it. Pair with vitamin C for better absorption and healing. Combine with a complete protein source, like whey or a plant-based protein, to ensure you get all essential amino acids, especially if you're recovering from surgery. I think a lot of people supplement collagen thinking it's a complete protein, but it is not. All right, the next important consideration is monitor for allergies. Marine collagen is sourced from fish, so if you have a fish allergy, just be cautious. All right, next is to start low and increase as tolerated. And lastly, check with your provider if you have a history of kidney issues, are pregnant, or are on a restricted diet for some health reason. If you found this video helpful, please give it a thumbs up, share it with a friend who's navigating endometriosis, and let me know in the comments, have you tried collagen supplementation? What's your experience been? And if you want more science-backed endo-specific supplement content, don't forget to subscribe and hit the bell so you never miss a video. Thanks for watching, and I'll see you in the next one.